Welcome to the Illinois Primary Healthcare Association's Health Talks podcast. On this podcast, we highlight incredible individuals who advance community healthcare, advocacy, and public health while striving to improve patient care.
Welcome to our second in our three-part series on immunizations. Health Talks presents Before the First Bell. My name is Paula Campbell with the Illinois Primary Healthcare Association, and today we're having a conversation on school vaccines, requirements, and protecting student health. Our guest today is Melissa Graven with Illinois Public Health Association, Immunize Illinois Coalition Manager, and Dr. Jennifer So with Illinois Department of Public Health, Pediatric Medicine Medical Advisor. To start us off today, why are immunizations such an important part of preparing children for a successful school year?
Well, thanks. First of all, thanks for letting me be here and talk. It's a great conversation to have. Perfect time as well. So immunizations is just one more tool in the tool belt, one more thing parents can do to help set their kids up for success for the school year. It helps to ensure they're fully protected from all the fun that they're going to have during the school year around all their friends in a setting close together. It ensures they can fully participate in their, not just their education, but, school's also a really important social aspect for a kid, young as they get older. So it makes sure that they can be fully engaged with their education, all the activities they like to be in, and that they can hang out with their friends in a way that everybody can stay safe and healthy.
I love talking about school vaccines. I love talking about school. I love school. I'm a big nerd. But vaccines are so important for our kids. And it seems like school just ended, but right now is the time to think about going back to school. So thank you for all the clinicians out there for all of the school child checks that you're doing. But like Melissa said, it's a way to make sure the kids stay healthy, that they stay in school, that they can engage with their peers and do all their activities. And it's not just setting them up for success in school, but really for their entire lives, right? These vaccines are priming their bodies to respond to infections in the long run. And just to do kind of a school-related reading metaphor, you can think about vaccines like beginner texts, right? They're helping the kids' immune system learn to read and comprehend the infection that they are encountering and to fight those infections off. So really important. And the other thing, again, since we're talking about school and education, I think when a child comes to a clinic to get their child check and sees that they're getting vaccines, you're also imparting that health knowledge on them that they can take with them as they grow into adults and have their own families. Really, really important, and glad that we're having this discussion today.
Thank you so much. Dr. So, can you walk us through the current Illinois school immunization requirements?
So I think for clinicians, I would really recommend that you focus more on the medical and public health recommendations to frame them as this is important for your child's health, the health benefits, rather than thinking about it or framing it specifically in terms of the school requirements. The school requirements, they're an important backup that we have. And they're also a way of letting parents and guardians out there know that we as a community, as a state, we really believe these are important vaccines that all children should get. And the long-term protection and health of the community, that's really going to rely on patients and families understanding the reason behind vaccines and trust in their importance. So again, a really critical role that our clinicians play as you engage with parents, as you engage with patients to make sure that they know that these are vaccines that are important. They're not just another requirement so a child can go to school. That being said, it is important for you all to know what the requirements are so that you can use that as a tool in your toolbox as you're having these conversations with parents and guardians, especially those who may be more hesitant about getting the vaccine, to let them know that this is required for school. So in terms of the school requirements, they largely align with our medical and public health recommended schedules. But just for awareness, there are some vaccines that are on that childhood immunization schedule that are not required for entry into school or daycare. So for example, the HPV vaccine is not required for school. CO and COVID-19 vaccines also are not required for school or daycare. And then for our younger children, hepatitis A vaccination, rotavirus, the new RSV immunization, those are not part of the legally required immunizations that a child needs to have to enter into daycare. What I will say, though, there are no updates in terms of the school requirements. This is a question we have been hearing a lot from our communities with all of the changes happening around immunizations and recommendations. So no changes here in Illinois. And I will say that, in terms of ending on a bit of good news is that We have our school vaccination coverage dashboard on our website. And when we looked at this last school year, we saw that the rates for all of our school required childhood immunizations, they were holding steady compared with the prior year. And really all but one of the school required vaccines were at our state goal of trying to get 95% or higher as being covered. And that was the meningococcal vaccine. And we know as, clinicians that it can be really hard to get teens back in for that 16-year-old second dose. So just flagging that is really, really important, but we're getting close for that vaccination too. And the rates seem to have risen just a little bit. This is all to say excellent work that clinicians are doing out there. Please keep it all up.
Great. That was wonderful, Dr. So. Melissa, would you have anything you'd like to add to that?
Dr. Stone made two really excellent points in that there are vaccines that are required for school, but there are vaccines that are highly and strongly recommended that are fantastic tools for parents to have discussions with their healthcare providers about. She mentioned, of course, the HPV. That's the one that comes to my mind, especially it's combined with a couple other vaccines. So parents are often skeptical to get all three at the same time, which they totally can. You can get more than one or two injections at the same time. So I just want to reaffirm that having that discussion about HPV vaccine is so important. And then again, what Dr. Sudd touched on about immunization rates in Illinois and just again, stressing clinicians are doing a fantastic job with us hitting the rates of coverage throughout the state with those required, with all but one of the required school vaccines. No, I just wanted to tag on to the brilliance of Dr. Suh and what she discussed already.
Some of the questions that we get or that we hear are misconceptions that parents may have about school vaccinations and requirements. Can you spread some light on some of the most common questions or misconceptions that you hear or come across?
Working in public health and around vaccines for a while now, I think all of us probably can relate to the first week of school starting and getting a lot of phone calls about, I didn't realize they need this vaccine, or I thought we were caught up and the school's not going to let them in, so we need to get vaccinated. I think that's probably one of the biggest things that we encounter in public health is parents thinking it's going to be really easy to get kids in to get that one vaccine that they need when there's probably a lot of parents in a similar boat. I have seen, and I do see a lot of providers, health departments pushing out communications early to remind parents, even if they're not need that school physical this year, you might still want to go in and get that wellness checkup just to make sure that we are fully up to date. I think assuming your child's up to date on everything, it's always a good idea just to check in with that healthcare provider to see, am I up to date with everything the child needs? We've also encountered, and I imagine several clinicians listening to this have encountered, well, can I just get an exemption until I can get all my vaccines? And I know that's been something that's been run into. When really the schools are really open to working with families to ensure that child stays in school. That's the goal of everybody involved, right? Is making sure the child gets in school and can stay in school, and they're willing to work with. You might not have everything, but as long as we can track the progress and ensure you're getting your vaccines, we're going to keep you in school.
Just want to lift up what Melissa said, that many parents don't actually realize what the requirements are. But again, as we both mentioned, it's really important to talk about these vaccines generally, that these are important from a medical standpoint, including for ones that are not required. So just wanted to emphasize that again. If the requirement piece counts out, talk about it. Otherwise, make sure you're getting your strong vaccine recommendations according to the medical and public health guidelines. That being said, some other misconceptions or questions that we have heard that parents and guardians have, and this was from a survey that we did of schools last spring during the measles outbreak. We had surveyed schools to just see what the barriers were that they were seeing to their students getting vaccinated. So one was actually still vaccine safety, efficacy, just questions about the vaccine. So just really highlighting that it's important for all of us as clinicians, public health professionals, to make sure that we don't assume that families know this information. So making sure we're making time to address that. Another one that I saw was that there were cost concerns, but there are many mechanisms for families, students who might not be insured for whatever reason, and, students who are insured through Medicaid. We have our Vaccines for Children program. And I know many, if not all community health centers are part of our VSC program. So these provide vaccines at no cost to the students. So just making sure that families are aware that cost should not be an issue. We have this program in place so that all children in Illinois can get their vaccines. And I think the other just kind of thought around the requirements is that, as I mentioned before, that, many times it's viewed as another step, another administrative hurdle, another, piece of paperwork that has to be done so my child can go to school. I think we can really do a better job of making sure parents and guardians really understand the long-term health and public health benefits, the reasons behind why these vaccines are being given. As a clinician, I have always viewed the school physical form. Yes, that's something that you have to fill out inside. And it is an extra step during the summertime, especially, but it's also a tool. It's a conversation starter. It's a way to kind of, in a very organized manner, talk to your patients about, here are the various screenings you need, here are the vaccines you need. So think of it as a tool and help our families, our patients know that this is all just trying to get them to be their healthiest and well selves.
In diving a little deeper, one of the big topics around immunizations today is around exemptions and public health considerations. How does the religious exemption process work in Illinois?
So this is an area that we have been paying very close attention to in public health. So you all know we have been seeing a rise in religious exemptions and non-medical exemptions in our states, and that's the case across the country as well. Last school year, religious exceptions in Illinois increased by nearly 25%. So they went from about 18,000 in the prior school year to nearly 23,000 students with religious exceptions in Illinois this past school year. So something we really need to think about, look at, and see what's going on. One thing to note here in Illinois, there are no personal or philosophical exceptions for school vaccines. So these are all religious exceptions. And so I think what we can do as clinicians is to, first of all, make sure that the appropriate process is being followed. And step one is to have that conversation with the family so they understand. I think Melissa brought up a great point. I have been wondering if maybe some of this, the rise in exceptions, religious exemptions, because families are having a hard time accessing care to get their needed vaccines. And this is a way that they can make sure their students are getting educated. So just something to think about. But for religious exemptions in Illinois, there is a specific form that a parent or guardian needs to complete. They can't just be on a separate piece of paper. There's an Illinois state-provided form. And then the parent or guardian, they need to provide a statement of specific religious belief for each vaccine or exception that they're requesting. So they can't just put that form, my religion doesn't allow me to get any vaccines. They have to list out each required vaccine and then put the reason why their specific religious belief doesn't allow for it. So just one thing to keep in mind, they're supposed to take this form, bring it in to you all as clinicians, and then have that conversation. This form has to be signed by the same clinician who performs and signs the child's health examination. So this is one piece of the requirement that many people don't know. So they can't go to just any healthcare professional and get it signed. It has to be the same person who did that well child examination and signed the certificate of child examination. Why is that? That's because we want to make sure parents and guardians have that conversation, that in-depth conversation with a clinician who knows their child's history to talk about what would happen if their child were exposed. The clinician should go over and ensure the family is aware that if there were a disease outbreak or an exposure in school, that the school exclusion policies will apply. So the child might need to be excluded from school if they were exposed and they're not vaccinated. And then the other thing to keep in mind is I know some clinicians, you might be thinking, I really don't want to sign this. I don't want this to be an endorsement that I agree with this. Your signature is not an agreement. Your signature is stating, I had the conversation with this parent or guardian. I went through all of the benefits of vaccination. I made sure that they understand the risk and then sign the form. I think that, another question that's come up is, well, who determines if the exemption is valid or not? I think the first step is your responsibility of the clinician is to make sure the form is correctly filled out. And then each local school authority will be responsible for making sure that all of the components of the form will fill out correctly and whatnot. But that is a really important step that you all can do. So the local school authority is about to read the form. And then I think the other important thing is that you should be providing parents and guardians, let them know that if you change your mind, because I think, these are conversations that are going to take time for parents who aren't ready yet to get their child vaccinated. You did an important step to move that needle forward, but make sure they're aware, because this apparently came up in Texas during the measles outbreak, where some parents and guardians would initially find exemption forms or didn't want to get vaccinated. They were like, is it okay? Like, can I actually now get my child vaccinated? And the answer is yes. So make sure that parents and guardians know you can always come back. At the next well-child visit, we will talk to you again about vaccines. There's always an opportunity to get vaccinated. If you decide on this in the future, let me know what else I can give to you to help make that decision. The important thing is make sure that the form is completed correctly and that it's the same healthcare professional doing a raw child check who is citing the religious exemption form.
I want to affirm Dr. Suh's statement that the providers are not expected to be arbiters of the information on that form. Their role is simply to have that conversation with the parent so they understand the pros, cons, risks, benefits of not getting that vaccine versus getting that vaccine. And I think that's another thing parents don't necessarily fully understand either, is that a medical provider needs to sign that religious exemption document. That can cause a lot of tension and stress for them, thinking, I have to do one more step to get this exemption. It's yes, but it's a really important step to make sure you have the full access to evidence-based information on why not getting this vaccine or vaccines could potentially put your child in a situation where they are not able to be at school.
Well, adding to that, I think I'd like to ask, what happens during a vaccine preventable disease outbreak in a school setting, particularly for those students who are not fully vaccinated or have those exemptions? What happens? What kind of next steps does the school or the community have to do with an outbreak?
So I think the first thing to keep in mind is that the goal is to keep everyone safe, to keep the school's community safe, the students, the staff, any visitors, and really to prevent the further spread of disease. So all of the activities that we do as public health in partnership with the schools and clinicians as well is to make sure that everyone is safe and that they get appropriate care as needed. One thing to really make sure as you're engaging with families who may be seeking exemptions of any type, whether it's a medical exemption, alternate schedule, religious exemption, is that exemptions from the school immunization requirements are not an exemption from school exclusion if there is a case or an outbreak. Because again, safety of the student is paramount. Preventing the spread of disease is what we're really trying to prevent here. Taking measles, for example, I think this is something that many parents and guardians, when they hear, they don't realize the impacts, right? For measles, if a student is unvaccinated, they are going to have to stay out of school. They're going to have to quarantine for 21 days. And that's just for one exposure to a measles case. That is a lot of time. Perhaps there are staff or others who have been exposed. If they're not protected, they're also going to have to quarantine, right? It's a big impact on school operations, but more importantly, it's a big impact on learning, attendance, beyond simply the academic piece of it, the engagement with others, their peers, being able to do the activities that a child needs to be doing at that time. Let's not underplay the impact on the parent and guardian themselves if they work, or even if they don't. Like, it's going to affect their lives too. Really, it's a lot of energy and resources go into identify who needs to be excluded for their safety, what needs to be done, who needs to get the care that they need, and making sure that all unprotected, exposed people are getting the care that they need. It takes a lot of resources from the public health departments, from the schools, and then many clinicians will be called on to help as well. A lot could be prevented with a vaccine. A lot of this, making sure kids are staying in school, but also for lifelong protections. Again, exemption from a school immunization requirement is not an exception from needing to be excluded in school if there is a case or an outbreak.
For 15 years, I worked as a communicable disease nurse as a local health department, and we dealt with several outbreaks, primarily 2 pretty significant mumps outbreaks. I can attest to what Dr. Suh said about a lot of work goes into determining who's considered susceptible. So that would be anybody, including teachers, anybody in that building who is either unimmunized, unvaccinated, or under-vaccinated. So maybe in the case of mumps, they only had one of their MMR and not 2. That would be considered potentially a susceptible person. And so, those individuals who are considered susceptible, depending on the disease or the infection, are excluded from school, and they're excluded for 2 incubation cycles, typically after the last case is identified. So in the particular outbreak we were working, it went on for about 6 weeks, and then we had to wait 21 days from that last confirmed case. There were students out for almost 2 months, and like Dr. Suss said, that's a huge impact on a family trying to arrange for somebody to be in the home with the child because they can't be left home alone. Something else to consider, and this may go by school district to school district, is if your child is excluded, especially if it's a religious or not a medical exclusion, then you get into some conversations with the school district about their responsibility to ensure the education to the student. Because if there's a medical exclusion, there are certain legally protected things they have to do to ensure that education continues. When it comes to religious or philosophical, it gets a little murky. And I don't want to step into those waters, but it's just something to consider when you're thinking about if we're going to pursue an exclusion. This is potentially what could happen if there's an infectious disease. My child is not protected through vaccine. I just wanted to add that in. It's not meant to muddy the waters or color the situation. It was just real world facts of what happened and things we never thought about. Now I have a keener brain to, or I think about more often when I think of exclusion from school. It's not just, okay, you don't have to go to school, but it's for a long period of time. And what is my student missing out on because of that?
Those are some very important highlights that you mentioned there. As we've talked today, a couple things have come up. One was about catch up on vaccinations for those who maybe are behind, and then also on access. For families whose children are behind on vaccinations, what are the best steps to get caught up before the school starts?
For students who are behind on vaccines, the best thing is to figure out what vaccines you need to be caught up on, right? And then creating a plan. If you have a primary healthcare provider that you can have that conversation with, that's fantastic. But if you're a family, perhaps it's new to the area, you haven't established, or you don't have the ability to have a primary healthcare provider, I will always sing the praises of local health departments and the public health nurses that work there. They work really closely, not with providers in the community, but school nurses to help assess school records to see what children need, what's considered an accurate dose of a vaccine versus not an accurate dose. I would say families, as soon as they think they perhaps are behind on schedule, should really call their healthcare provider or get in contact with their local health department to set up an appointment to go through their vaccine record if they have access to it. Go through their vaccine record and provide a plan. They are really great at strategizing and providing out a plan of, we need to get these vaccines today, depending on what vaccine you're giving. If it's a live virus, you might have to wait a few weeks before you can get your next set. But they're really great at strategizing and working out a plan and then communicating with the school about that plan. So the school feels even more comfortable. They're working with the health department or their healthcare provider. They've got a plan. We're going to let this student come to school with no exclusions while they're working through the process.
So, it's a really busy time in the summer. It's like, I know the work is never ending. Winter is busy too. And summertime gets really busy for those of you who see children, but it's also an advantageous time to get the kids in. They're not in school. There may be more flexibility in the family schedule to bring their child in because they don't have to rush them off to an after school activity or whatnot. I think, again, going back to that survey they did last spring of schools to tell us a little bit more about the barriers they're seeing for vaccination, they also brought up, difficulties accessing their clinics or healthcare. And so if at all possible, and I know many clinics are doing this, I know local health departments do too, considering doing extended hours or weekend hours just to get in those extra visits for the children who need them. I think that would be really helpful for them. And then I think reminders well in advance too. It's not just summertime or just as a filter school requirement. I think Melissa touched on this, right? A child should be coming in every year. I mean, of course, for the little ones, it need to be coming in more frequently, but setting out those reminders, because it's really hard for families to keep up with when the vaccines are due. Just doing recall reminders if you can, not just in the summer, but throughout the year. And I know many electronic health record systems can help with this. I think it'd be really great to just help our parents and guardians out to give it those reminders. Just really a great resource that Melissa pointed out for the local health departments, and they aren't able to access your own clinic. And then I just have to plug the school health centers. I think they do such a great job. I think school is an area where we can really, really try to get healthcare access for our children too, because they're there for most of their waking hours, at least during the school year. So just another resource there. And I just wanted to plug, we have a mobile vaccine partner, Centaur. They've been working with us to go out to communities across the state to get children up to date on their vaccines. It was initially brought on with a focus on measles vaccination, but they're out and about throughout the state right now, working with schools and communities organizations to do back to school fairs and whatnot. If you find that a family is unable to access your own clinic, maybe think about the local health departments, see if the school district is holding a back to school event, because it is possible that either your local health departments or our mobile vaccine partners then are maybe allergic vaccines too. At the end of the day, ideal world, we want every child to have a medical home. We want you all to be seeing without having that long-term relationship, but we know that there are many challenges and barriers to that.
I wanted to touch on one thing about the recall reminder system. With the work with the Immunize Illinois Coalition is doing, we have worked with partners that offer a free recall reminder that'll integrate with your EMR and the vaccine registry, because recall and reminder is a lot of work. It's a lot of man hours, especially if you're doing it manually. You might be pulling a nurse or office assistant to do that who might be needing to do other things. If anybody is interested, please reach out to Immunize Illinois. We can put you in contact with these systems that can do it through texting, calling, postcards. They provide everything because they believe in the importance of getting kids in for their vaccines. And they do it not just for kids. I know we're talking about kids, but also for maternal child health, pregnant women, older adults. I just wanted to put that plug in there in terms of such an easy thing to do, but it is labor intensive, that I wanted to provide that resource.
Thanks for adding that. I wanted to highlight, you both had mentioned a little bit about how families may not have a regular healthcare provider, or they may be concerned about vaccine costs. Could you expand a little bit on resources for families who might be facing these difficulties?
Absolutely. Again, Dr. Suh has mentioned the Vaccine for Children's program, and it's an amazing program that we have in the state of Illinois with several providers enrolled as VFC providers throughout the state. Illinois Department of Public Health actually has a wonderful dashboard on their immunization website that you can look for VFC providers in your state. And the Vaccine for Children program is there for children who are not insured or underinsured, because truly it's so important that kids have access to these vaccines, that there's so many different programs in place to ensure that cost is not an issue. There's the Vaccine for Children's program. A lot of our federally qualified healthcare centers provide services to children, and most of them, if not all, are probably also VFC providers as well. You find you're in a situation where you don't have a primary healthcare provider, or perhaps your primary healthcare provider is not enrolled in the VFC program, I would encourage you to reach out to Illinois Department of Public Health. They would get them enrolled as a VFC provider. However, FQHCs and local health departments are often VFC providers that really work hard to ensure those underinsured and uninsured kiddos have access to vaccines.
Thank you to all the community health centers who are VSC providers. I mean, we know community health centers are so important, but really, really important for our uninsured, underinsured children, also our Medicaid covered children. So in terms of where Medicaid insured children can get their vaccines, it's really our Vaccines for Children providers, community health centers, and then also local health departments as well. We're working on this to try to improve access, but unlike children who may be privately insured, a pharmacy is not an option for our Medicaid insured children at this time. So thank you for all you're doing as community health centers. For those of you who are at a community health center listening, you are a vital access point for many, many children in Illinois. We would like to hear from you too. So again, whether it's reaching out to Immunize Illinois or our health department, just let us know how else we can serve our communities and your patients.
I agree. I think community health centers are another unlauded hero. They do amazing work in that they know that this could be the the last time they maybe see this patient or this client for a while. So they really try to provide holistic, integrative care while that patient or client is in their office. Like, okay, what are you due for? What can we get now while you're here so that 6 months, 9 months, life happens, so that if they can't get back, they try to provide them the best care that they can while they have them in front of them. So I just wanted to also uplift that as well.
Are there specific populations or communities that face greater challenges of accessing vaccinations?
Yeah, so another one barrier that schools identified were just not having enough healthcare access and also transportation issues. And we've heard from our local health departments in rural counties that they also see the transportation fees being a barrier. Those who are living in rural counties, those who may be living in other healthcare shortage areas, certainly those children are facing greater challenges as vaccinations. I will also highlight, there are some children who may be experiencing homelessness, unstable housing. They do get an exemption called the Kenny-Bento exemption, so they can still come to school because it's so important that they get educated. And schools work then to make sure that they get up to date on their vaccinations. Again, an important role that clinicians play too, to make sure that those students who are facing other challenges are getting vaccinated. We know too, with everything going on, that those who may be immigrants or newcomers to our country may have challenges accessing vaccines. I think some of it is due to fear of what may happen if they access vaccines in certain ways. So again, such important work that our community health centers are doing to provide this access in this welcoming environment. I got one of the departments as well. And I think I just want to highlight, this surprised me a little bit from our school survey from last spring. Another barrier that some of the schools mentioned was one, that clinicians may not be recommending vaccines according to the recommended schedules, or that they might not even be talking about vaccines at the well-child check. We know how busy clinicians are, but if you're not sure about the recommended schedule, check out our website, right? dph.illinois.gov/immunization. We have the schedule right there. Make sure, Melissa touched on this, so important. Every visit, whether it's a well-child check or another visit, it's an opportunity to talk about vaccinations. It's hard for parents and guardians to remember the vaccine schedule. So whatever you can do as a clinical team, making sure the vaccines that are needed are talked about at every visit, I think will really help out.
And probably a lot of it's encompassed in what Dr. Suh has already shared with us. But in terms of transportation, my mind always goes to the more rural parts of our state. We do have parts of our state where the nearest doctor or access to care could be a 30 or 45-minute drive, a trip to town, if you will. And those are usually very strategically laid out when those trips to towns happen, because it's not as easy just to go down the block and get to the pharmacy or get to the grocery store, particularly with transportation costs and not access to a transit system. I'm always concerned about our more rural residents and how they can get access to vaccines. And I think another population we often in healthcare is those who have a very low trust in government and health systems already. And accessing those communities can be very difficult. So I think it's really important for healthcare providers and local health departments to really partner with community-based organizations or agencies in their community that have access and that are a trusted messenger to those communities, because they need vaccines as much as everybody else. Building that trust can take time, and I think it's really important to align with those organizations that are trusted messengers so that they can be the messenger. They can be the ones providing the message to that community for that initial trust. Otherwise, Dr. Suh said them all, yeah.
Dr. Suh, I wanted to ask, how is the Illinois Department of Public Health and community partners working together to support schools and families in meeting immunization requirements?
I think one thing we've been really doing a lot over the last year in particular is making sure that we all have our common message about the importance of vaccines and the schedule that the Illinois Department of Public Health is endorsing for children, the American Academy of Pediatrics schedule, on their evidence-based schedule. And so we're working a lot with clinicians. I think that's the other thing we're really trying to do more intentionally, is really work with our healthcare partners, our clinician partners, because you all are the ones who are providing the vaccines, and so important to make sure you have all the supports you need. We're partnering with organizations like the Illinois chapter of the American Academy of Pediatrics, the Illinois Academy of Family Physicians, IPHCA, Immunize Illinois Coalition. So lots of different partners, all making sure our communities have that unified, important message. Well, as I talked about, the Vaccines for Children program. So, the Illinois Department of Public Health administers that program for all of the counties, all jurisdictions outside of the city of Chicago, and our Chicago Department of Public Health administers that program in the city of Chicago. So really working together to make sure that no child is unable to access vaccines because of concerns about cost. A lot of work with our local health departments. We are the state health department, but the local health departments are the ones who are the boots on the ground, really oversee the work within their own counties and their jurisdictions. They really know their communities so they can take our state guidance and the messaging and tailor it to their specific communities. I mean, so many partners, right? There are state agency partners. We are working really closely with the Illinois State Board of Education, really grateful for all the partnership there. For Illinois Department of Early Childhood, for early childhood daycare space, Head Start as well, working with individual schools, especially, because we have our school vaccination coverage dashboard. We're looking at some schools who might need a little extra support or guidance to help increase vaccination rates in their schools. And then, as I mentioned, we have our mobile vaccine partner, Simpar. And because we know that there are these transportation issues, we're hoping if we bring vaccines to communities rather than asking parents and guardians to figure out how to get their children to a specific location, if we just go into the community, we're hoping that will help increase access as well.
Melissa, do you think you could expand on the role that Immunize Illinois Coalition is doing in this work as well?
Oh, absolutely. Yeah. In terms of Immunize Illinois Coalition, we really feel our role is to amplify Illinois Department of Public Health's recommendations and the AAPs, particularly in this space. They are the subject matter experts and they're their guiding principle for the state of Illinois in terms of vaccine recommendations. So we really feel our job is to make sure we get out and spread the message far and wide in supporting. Illinois Department of Public Health is a big entity, but there's only so much you can do in a 24-hour day. We really try to make sure we can pick up where they need to leave off while they're working one-on-one with the providers and all the different state community organizations, which are also partners of the Immunize Illinois. We really want to try to make sure we get down to the more granular, that we can have information accessible through our coalition and on our website and through our newsletter. I feel like the more times individuals can see it, the better, so that we just continue to push out that information and amplify to our partners. I think some really successful examples of partnerships are, hopefully a lot of clinicians are aware of, our back to school events that really bring communities together. It is usually a partnership between like a local health department, a community-based organization, even school systems, in which they host big fun events that are very family friendly. Not only can you maybe get your back to school shots there, but you might be able to get your sports physical. You could even get your back to school physical. They can do backpacks to make sure kids have backpacks and some supplies for their school year. There is no back to school event that looks the same. So what we're trying to do at the coalition is to kind of highlight those partnerships that are happening across the state. So we're asking any agency, health department, community-based organization, anybody that's hosting some kind of event focused on back to school, let us know. And we're compiling a list, if you will, by county. So we can promote this website, this list, that anybody can see what back to school events going on in my community. They can look it up and see exactly what's going to be offered. We're hoping to be flooded with all the flyers and that we have representation from all 102 counties in the state of Illinois so people can know where they can get to. Some of these events even offer transportation. They'll come and grab you and can bring you to the event and take you home, because that is definitely a barrier for a lot of families. So I think the more healthcare providers, local health departments, and CBOs can partner together, the better.
Well, thank you for that expansion. It's been a great conversation with both Melissa and Dr. Saw. In closing, I'd like to hear from both of you on what is the one message you would like parents, caregivers, educators, healthcare providers take away as they prepare for the new school year.
I really want to emphasize that we are accountable, and that is to set our children up for success, not just in school. School is so critical, but for their lifetime. So we're really trying to keep kids well and healthy by promoting these vaccines. Keep in mind, most Americans trust vaccines, support school mandates. In fact, surveys have been showing that. So really good to hear. We're all in this together. And our Illinois Department of Public Health, we're here for clinicians, families, communities, because again, common goal let's set our kids up for success.
Absolutely. I think just touching on kind of what Dr. Suss said at the end, it's a shared responsibility. We know it's a shared responsibility between the families, the healthcare providers, the school system to make sure everybody's in communication. They know the expectations. We know families can get so busy. I know it's so easy to let that back to school physical drop off my priority list or, oh my gosh, I forget. So allowing that grace that sometimes life gets in the way of these things we have to get done, showing grace to our clients and patients. And then, of course, our community showing patience to the healthcare provider that's swamped with, the 30 calls of trying to get somebody in for a vaccine. It's a partnership. We all have to work together. Some days I bring 90, some days I bring 10%. So just showing up for that differential to make sure we're in it together. We're all on the same side. We're all on the same team. Nobody's fighting against each other. So the more we can collaborate and bring that mindset, I think the more successful we're going to be.
Where can providers and families go to find reliable information about school immunization requirements, vaccine schedules, and local vaccination resources?
Yes, I'll plug our websites at dph.illinois.gov/immunization. So one-stop shop, you'll find all the schedules and guidance. You'll find the vaccine locator that Melissa mentioned before, where you can find vaccines for children, providers for adults, providers who also offer at no cost vaccines for those who may be uninsured or underinsured. And then also our dashboards, so you can keep track of how your school community is doing with vaccination. So dph.illinois.gov/immunization.
That's great. And Melissa, if providers are wanting to connect with the Immunize Illinois Coalition, where can they go to find more information about that?
Well, we have a website, which we're really excited. It's brand new, so we're still in that tweaking of what we want to put on there. If you search up Immunize Illinois Coalition, we should pop up. We're currently as part of our Illinois Public Health Association. You could also, if you would want to email Graven at IPHCA.com, we could add you to our listserv for VaxFacts. It's our monthly newsletter that we send out that compiles a lot of information that's going on that comes to your inbox the last Thursday of every month. And then as part of our listserv, we make sure if there's anything that comes down from Illinois Department of Public Health related to vaccines, we send that out to our listserv. So you're getting it multiple ways, potentially from IDPH directly. We try to amplify any messaging they provide to us so that providers in our network and throughout the state are aware. So yeah, that would be lovely if they would like to reach out and be a part of the coalition. We would appreciate that.
Well, I'd like to thank you both for joining us today for our podcast on Before the First Bell. This is the second in a 3-part series on immunizations. We hope all of you will join us again for our third part.
If you enjoyed today's episode, don't forget to like and subscribe on your preferred platform. It helps us reach more listeners and create more content like this.